Vaginal suppositories offer a targeted approach to treating various vaginal health issues by delivering medication directly to the affected area. These small, often bullet-shaped medications dissolve at body temperature, releasing active ingredients that are quickly absorbed by the vaginal tissues. This localized delivery allows for a more rapid response compared to oral medications, which must travel through the digestive system. Commonly used to address conditions such as yeast infections, bacterial vaginosis, and vaginal dryness, suppositories provide relief by directly targeting the source of discomfort or infection. The administration of vaginal suppositories is straightforward, though it requires attention to hygiene. Before use, it is crucial to wash hands thoroughly with soap and water to prevent introducing any additional bacteria into the vaginal area. Most often, suppositories are inserted at bedtime, allowing for optimal absorption while the body is at rest. The correct insertion depth is typically about 2 to 3 centimeters, ensuring the suppository is well placed to dissolve effectively and release its medication. Patients may notice a mild discharge during treatment, which is a normal part of the process. This discharge is primarily excess medication being expelled and should not cause alarm unless accompanied by unusual symptoms such as a foul odor or a change in color, which could indicate an infection. It is advisable to consult a healthcare professional if any concerning symptoms arise. While vaginal suppositories are generally well tolerated, they may cause mild side effects like itching or irritation. These effects typically diminish as the body adjusts to the medication. However, any severe reactions warrant immediate medical attention to prevent complications. Vaginal suppositories work by utilizing the body's natural warmth to dissolve and release medication directly into the vaginal tissues. This localized approach allows for a more immediate and effective treatment of conditions such as yeast infections, bacterial vaginosis, and vaginal dryness. By targeting the affected area directly, suppositories can provide quicker relief than oral medications, which must first pass through the digestive system. This method is particularly beneficial for treating recurring issues like yeast infections, where the active ingredients in antifungal suppositories inhibit fungal cells, thereby stopping the infection from spreading and alleviating symptoms. Administering a vaginal suppository requires careful attention to hygiene. Hands should be thoroughly washed with soap and water, and the suppository should be prepared on a clean surface. It is generally inserted before bedtime, allowing the body to absorb the medication while at rest. To ensure proper placement, the suppository should be inserted approximately 2 to 3 centimeters into the vagina. This depth facilitates effective dissolution and absorption of the medication into the surrounding tissues. The dissolution process typically begins within 10 to 15 minutes, with many users noticing an improvement in symptoms within the first few days of treatment. A slight discharge following the use of a vaginal suppository is normal and should not be a cause for concern. This discharge is usually excess medication being expelled as the suppository dissolves. However, if the discharge has an unusual color or odor, it may indicate an infection, and consulting a healthcare professional would be advisable. While mild side effects such as itching or irritation are common and generally subside as the body adjusts, any severe reactions should prompt immediate medical attention. It's essential to follow the prescribed course of treatment to ensure the full effectiveness of the medication while minimizing potential side effects. Vaginal suppositories are used for a variety of reasons, primarily to address common vaginal health issues such as yeast infections, bacterial vaginosis, and vaginal dryness. These conditions can cause discomfort, itching, and discharge, and suppositories offer a targeted approach by delivering medication directly to the site of the problem. Yeast infections, often caused by an overgrowth of candida fungi, can be effectively managed with antifungal suppositories that inhibit fungal cell growth and alleviate symptoms. Bacterial vaginosis, on the other hand, involves an imbalance of natural bacteria in the vagina, and specific suppositories can help restore this balance. Vaginal dryness, which can be due to hormonal changes or other factors, is often treated with suppositories containing moisturizing agents that provide relief by enhancing lubrication. The quick action of vaginal suppositories is advantageous. They dissolve at body temperature, allowing the active ingredients to penetrate the vaginal tissues rapidly. This method bypasses the digestive system, offering a more direct and efficient treatment. Users typically notice symptom improvement within a few days, although it is crucial to complete the full course of treatment as prescribed to ensure effectiveness and prevent recurrence. While generally safe, it is important to be aware of potential side effects such as mild irritation or itching, which are usually temporary. However, any severe or persistent reactions should be discussed with a healthcare provider to rule out allergies or other complications. Consulting a healthcare professional before starting any new treatment is always advisable to ensure it aligns with individual health needs and conditions. Properly inserting a vaginal suppository is essential to ensure the medication works effectively. Begin by washing your hands thoroughly with soap and water to maintain hygiene and reduce the risk of introducing bacteria into the vaginal area. Unwrap the suppository and, if it feels soft due to warm temperatures, it might be helpful to briefly refrigerate it to firm it up, making insertion easier. Choose a comfortable position for insertion, such as lying on your back with knees bent or standing with one leg raised. Gently insert the suppository into the vagina, aiming for a depth of about 2 to 3 centimeters. This depth ensures the suppository is well placed to dissolve and deliver the medication directly to the targeted tissues. It's often recommended to perform this step before bedtime, allowing the suppository to dissolve and work overnight, which minimizes leakage. During the dissolution process, the active ingredients are absorbed by the vaginal tissues, which can lead to a mild discharge. This is generally normal and part of the body's way of expelling any excess medication. Wearing a panty liner can help manage this discharge and keep you comfortable. If at any point the discharge becomes foul-smelling or is accompanied by unusual colors or symptoms such as itching or burning, it's important to consult with a healthcare provider, as this could indicate an infection or irritation. While using suppositories, some mild side effects like irritation or itching may occur but typically resolve as the body adjusts. However, if any severe reactions occur, such as intense discomfort or signs of an allergic reaction, discontinue use and seek medical advice promptly. Always adhere to the full course of treatment as prescribed, even if symptoms improve, to ensure the infection or condition is fully resolved and to prevent recurrence. Consulting with a healthcare professional before beginning treatment can provide guidance tailored to your specific health needs, ensuring both safety and efficacy. When using vaginal suppositories, it's important to be aware of potential side effects and how to manage them. While these medications are generally safe, some individuals may experience mild symptoms such as burning, itching, or irritation in the vaginal area. These reactions are often temporary and tend to diminish as the body adjusts to the medication. It's reassuring to know that such side effects are typically not a cause for concern unless they persist or worsen over time. In rare instances, more severe reactions can occur. If you notice intense burning, severe itching, pronounced redness, or swelling, it's crucial to discontinue use and consult with a healthcare provider immediately. Such symptoms might indicate an allergic reaction, which, though uncommon, requires prompt medical attention to prevent further complications. It's always advisable to follow the prescribed dosage and instructions carefully, as misuse can reduce the treatment's effectiveness or exacerbate side effects. Managing minor side effects involves maintaining good hygiene and ensuring proper insertion techniques. Keeping the area clean and dry can alleviate mild irritation, while using panty liners can help manage any discharge resulting from the suppository dissolving. If discomfort persists, consulting a healthcare professional is the best course of action to address any underlying issues or adjust the treatment plan. To maximize the effectiveness of vaginal suppositories, adhering to best practices is essential. Begin by ensuring that your hands are thoroughly washed and the area is clean before insertion. This reduces the risk of introducing new bacteria and ensures the medication can work optimally. The timing of insertion is also crucial. Inserting the suppository before bedtime allows the medication to remain in place longer, which enhances absorption. This practice is especially beneficial as lying down minimizes leakage and helps the suppository dissolve completely. Proper insertion depth is another factor to consider. Typically, a depth of about 2 to 3 centimeters is recommended to ensure the suppository is placed where it can dissolve effectively and reach the affected tissues. Using an applicator can assist with accurate placement, although some may prefer manual insertion. It's crucial to follow the specific instructions provided with the medication or those given by your healthcare provider to ensure optimal results. Pay attention to how your body responds during treatment. While mild side effects such as slight irritation or temporary increase in discharge are common, these should not be severe. If you notice unusual symptoms, such as a strong odor or unusual color in the discharge, it may be an indication of another issue that warrants medical attention. These symptoms could suggest a different type of infection or an allergic reaction, both of which require professional evaluation. Finally, consistency is key. Completing the full course of treatment as prescribed is necessary, even if symptoms improve before the treatment period ends. This helps prevent the recurrence of the infection and ensures that the underlying condition is fully addressed. By following these guidelines, you can enhance the effectiveness of vaginal suppositories and manage your health more effectively. Consulting a healthcare professional is crucial when using vaginal suppositories, particularly if you encounter any unusual symptoms or reactions. These medications are generally safe, but individual responses can vary significantly. If you experience severe itching, burning, or swelling in the vaginal area, it's essential to seek medical advice. Such symptoms may indicate an allergic reaction or a need for an alternative treatment approach. Also, if you notice a strong odor or unusual discharge color, these could be signs of another underlying condition, such as a different type of infection, which might require a different treatment strategy. It's important to have an open dialogue with your healthcare provider about your symptoms and any concerns you might have. This communication allows for the tailoring of treatment to your specific needs, ensuring both safety and efficacy. Remember, vaginal suppositories are designed to address specific conditions like yeast infections or bacterial vaginosis, but improper use or self-diagnosis without professional guidance can lead to complications or ineffective treatment. Moreover, if you're using a vaginal suppository for the first time or are unsure about its correct application, consultation with a healthcare provider can provide clarity. They can offer demonstrations or additional instructions to ensure you're using the product correctly, maximizing its benefits while minimizing potential side effects. Adhering to medical advice not only optimizes treatment outcomes but also helps prevent recurring issues, ensuring your overall vaginal health is maintained. In summary, vaginal suppositories are a valuable option for treating various vaginal health issues such as yeast infections, bacterial vaginosis, and vaginal dryness. They deliver medication directly to the affected area, ensuring fast and effective relief. Following the prescribed course of treatment is essential to fully address the condition and prevent recurrence. While generally safe, individual responses to suppositories can vary, and it's important to consult a healthcare professional if unusual symptoms occur. Signs such as severe itching, burning, or changes in discharge could indicate an allergic reaction or another underlying condition requiring different treatment. Effective communication with your healthcare provider is crucial, as it allows for tailoring the treatment to your specific needs and ensures safety and efficacy. Proper use of vaginal suppositories includes understanding the correct method of insertion, typically at a depth of 2 to 3 centimeters, and ensuring hygiene by washing hands before use. The suppository usually dissolves within 10 to 15 minutes, with effects noticeable within a few days, but completing the full treatment course is essential for optimal results. Discharge after using a suppository is common and generally harmless, but if it appears abnormal or is accompanied by other symptoms, medical advice should be sought promptly. Awareness of potential side effects, such as mild irritation or burning, is important for managing expectations during treatment. More serious side effects should prompt immediate medical consultation. Finally, while the cost of vaginal suppositories can vary based on brand, ingredients, and insurance coverage, discussing options with your doctor or pharmacist can help manage expenses. Maintaining open dialogue and adhering to medical guidance ensures effective management of vaginal health and maximizes the benefits of treatment.